Hey, it's Chris with Rowe Dental Laboratory, and we have a very special guest today. We've been working with her and her company for a while now, and we have Joanne Villani from PreVu Software. And we're going to learn a little bit about how this software can help close cases, big aesthetic cases, small aesthetic cases. Overall, it's a great software. Like I said, we've been using it for a long time. So, Joanne, thanks for joining us. There's other options out there, and with so many new things within Office, you see so many times something just sitting in the corner due to lack of training. And I have been told, and I know this, that there's a great training program that it's almost you don't let them fail. So let's talk a little bit about the training program with PreVu.
If you fail with PreVu, it's because you did not take full advantage of the training that we offer. And I will tell you, we chase offices to get them scheduled. So one thing I want to say is a lot of doctors are like, oh, that's a lot of training because we have a full implementation protocol. Well, number one, retention for employees, much higher when they're trained. And trained employees are happier and they just do better in their job. So let's train them. We understand that our training protocol is several hours over a period of time, and we have a suggested timeline that you do it. But our training is not necessarily software, though it's included. We have a protocol so that we are helping you maximize revenue. We have very specific KPIs that our internal team is judged on based on the success of our clients. And with us, you have a client success manager who follows you through the training. However, a lot of offices don't go through our full training, and we will call them and we will basically hound them.
Right.
And a disadvantage for themselves that they don't do it. So our training is really, without getting into specific details, we have a full protocol and it's built into 2 phases. The first phase is we want to make sure that we train your team really quickly to be up and running to do simulations, while simultaneously you're generating an ROI from your spend with us. So we want you to make 3 times to 10 times what you paid us for the entire year within the first 60 days. So you have to use the software. So we give you scripting, we give you patient type to target, and we assign specific people to actually do it. And by 60 days in, you should 3x to 10x what you paid us. And then we move to phase 2, where now that everyone knows how to use the software and you've spoken to a lot of people, you started to build a pipeline of cases. Now we go full implementation where we're actually teaching you how to use this in specific patient appointments. We build it into your protocol, which means we work with your team. We say, hey, what's your protocol look like now? We don't want to completely change what you're doing, but if we're all being honest here, there is some change management that has to happen when you bring in any new technology, or else, Chris, like you said, it's going to sit on the shelf.
Yeah.
We want this to sit on the shelf because we feel like it's a win-win. The practice is making money, the patient is getting smiles that they love, and we have a long-term relationship with our clients. So we have a full protocol. I think it's what really sets us apart. And we definitely present it, and then we chase after people to complete it. Because sometimes there are people like, oh, we made my money back. Oh, this is easy. Oh, we're fine. And then they don't continue in and they don't build it really into their protocols. And they're like, oh, we forgot. Oh, we forgot. No, you need to have it in your protocol, because if it's not, it's like doing a root canal. You know exactly the tools you need when you're doing a root canal. If you're a doctor who's doing root canals, you know exactly what your process is, and you don't forget one of them just because, oh, you're too busy. So you have to have everything in place. The team has to know that you have the software, why you have the software, when it's appropriate to use the software, and when it is, it has to be built into the protocol. That's all the goal of our training. So yes, every new client, expect if you come to us, basically we have you commit to a time period so that we have the time to help you and your team maximize the revenue from the software.
Yep, no, that's a great message. Be ready to be trained. I mean,
be ready.
That's good. I like it. It. All right. Well, that's great information. Thank you so much for your time today. And please tell us how to get a hold of you. Website, email. What's the best way?
Yeah, so thanks for having me. This was fantastic. If you want to get a hold of us, you can go to our website, prevudental.com, Prevu dental.com. You can schedule a demo. There'll be a link right there, or just go down to the footer. Our email is there, our phone number is there. You can even reach us through chat on the website if you'd like someone to reach out to you. So we're pretty easy to find and get a hold of, and we'd love to talk to you.
Awesome. Well, thank you so much. And listen, if you guys don't want to reach out to Preview right away, please feel free. Contact us here at Row, and we're gonna get you there anyway. But if you have any questions on it, of course, definitely go to their site. But if you want to give us a call and talk through kind of what we've done over the years, we would love to have the conversation. So again, thank you so much.
Thank you. Thanks, Chris.